Afternoon, everybody. This is Bob Tygenhof. I'm the director of the Center for Active Lifestyle Medicine at the Integrative Medical Group in Irvine, California. This is today we're going to be talking about obesogens, chemicals that are in common widespread use that make you fat. This is the 6th in a series of 12 programs that we're doing on environmental toxins and exposures, and primarily not only to alert you to the dangers out there, but also to give you information in terms of how you can either counteract or avoid coming into contact with these things in the first place, which is always the preferable way of doing this, and protect both yourself and your family from the consequences of these things. On Saturday morning at 10 a.m., we're going to be talking about fatal fabrics, primarily the chemicals that are in the cloth and the materials that you use that are used both for clothing and for furniture. And there are a lot of different chemicals that are used in them. You need to know what to look out for, what things to avoid. We're going to touch on a few of those today because some of them happen to be obesogens as well, but we'll go into greater detail on that on Saturday morning at 10 o'clock, and that's Pacific Standard Time. Then on Monday at 6 o'clock, we're going to be talking about HEPA vacuum cleaners. And HEPA vacuum cleaners, which you've probably heard about, but may be wondering, so what's the big deal? Why I use a vacuum cleaner? Why is a HEPA vacuum cleaner relevant and a good thing to do? And we'll talk a little bit about the problem of particulate matter. And particulate matter comes in all different sizes. It has different effects depending on the size, and that really is the secret and the key behind the value of having and using a HEPA vacuum cleaner and using HEPA filters. But today we're going to talk about a group, 6 different chemicals primarily. They are either individual chemicals or groups of chemicals, and they are, the chemicals are known as Tributyl tin, which is a common ingredient in polyvinyl chloride PVC tubing. It's a building material used all the time. It's often used for water plumbing in your house. Any chemicals that come into it are going to leak out, or any water that flows through it is going to have some of the chemical leak out into it, and you're going to end up ingesting some of it. We're going to talk a little bit about atrazine and DDE. Atrazine is a pesticide that's used frequently in apples. So if there's any non-organic apple sitting in your kitchen, it's probably covered in atrazine. DDE is a breakdown product of our good old friend DDT, which has been banned for use in the United States, not worldwide, but in the United States, and we export tons of it overseas. But DDT has a very, very long life, and we are still suffering from the effects of years and years of usage of it. DDE is a very common environmental pollutant, and we end up suffering the effects of that. Another chemical group that we're going to be talking about are phthalates. Phthalates are used in fragrances. They're volatile organic compounds, so they aerate, and they are the carrier for a lot of the different fragrances that are used in perfume, soaps, laundry detergent, things like that. So you get exposed to them on a fairly regular basis. DES, diethylstilbestrol, is a pharmaceutical that was originally developed as an estrogen replacement and was hoped for in the 1930s when it was originally developed, that it would be the first estrogen synthetic estrogen that could be used for birth control or a variety of other treatment modalities, really didn't work out as a birth control. So it was used instead to control miscarriages in pregnant women. And it was used through the 1930s, the 1940s, into the 1950s, when they suddenly started to realize that the daughters of women taking DES ended up with abnormal reproductive tracts, and as well also seemed to have much higher rates of vaginal cancer, and as they aged and got older, heightened increased risk of breast cancers. We'll also talk about BPA. We'll focus more on BPA in another one of these episodes, but BPA is commonly used in, it was at one time used almost universally in the plastic lining of canned goods. So almost any can that you used had BPA in the plastic resinous lining that kept the ingredients away from the metal and kept the metal from dissolving into the food. Unfortunately, didn't keep the BPA from dissolving into the food, so we all got exposures that way. It's also used on cash register receipts, and if you get onto an airplane and don't use your smartphone, you get one of those airline boarding passes, and it has this very, very slick, slippery surface on it. That's BPA. And then we'll also be talking about PFCs, perfluorochemicals, which are used in nonstick cookware, on fabrics like Gore-Tex and Polartec, and any kind of athletic clothing often uses those types of fabrics. And so we'll be looking at all of those. Now, why are these things called obesogens? Well, because in addition to a host of other effects, among them cancer, Parkinson's disease, dementia, these wonderful chemicals also happen to make you fat. They disrupt, they are endocrine disruptors. They disrupt the normal functioning of the communication system that your body relies on to tell the different cells in the body what they're supposed to do. It disrupts that whole process, and it has a variety, in doing so, there are a variety of different mechanisms that these chemicals that we were just talking about, how they go ahead and make you gain weight. Many of them have their effects during developmental stages. So in the womb, pregnant women who get exposed to these, their children get exposed to them, and it makes very significant changes and differences in how they develop metabolically. But it can also have longer term, and ultimately these types of changes that occur during the developmental stages have long-term effects, and we very frequently see that as children get into their teens, they suddenly start putting on excessive amounts of weight, and yet they don't seem to be doing anything different from their peers who eat the same, do the same amount of exercise, that sort of thing. So why is this important? Why do we really care about whether or not these things are obesogenic? Well, as you probably know, 70% of the entire adult population of the United States is now either overweight or obese. It's a worldwide phenomenon. There are now more overweight and obese people than there are malnourished, underweight people in the world. That's been the case for probably 10 years now. All of the developing countries are going through explosive increases in obesity. And lest we think that it's just us, it turns out that research is showing that our pets are getting obese and overweight much more so than they did before. We see it in laboratory rats and mice. They're actually on the same diets that they were on years and years ago. They have seen a steady increase in base weight. We see it also in field studies, animals in the wild who are also exposed to this almost universal increase in chemicals exposures, they get exposed to them as well. And animals caught in the wild are also getting fatter. So we're all getting fatter. It seems to be that since genetics don't change that fast and that across the board like that, that it probably is environmentally driven. And these chemicals, we're really now just beginning to see that it seems to be that these are the chemicals that are driving this dramatic increase in obesity. Now, how do they do it? What's the mechanism? How do these chemicals make you gain weight? Well, on one hand, some of them actually affect what are called stromal stem cells. Stromal stem cells reside in the bone, and at an appropriate time, the body can send them signals to differentiate and become either a bone cell, which is typically what you want them to do, or the same stem cell can differentiate and become a fat cell. Well, a bunch of these different chemicals, tributyltin, for example, but atrazine, DDE, the phthalates basically all work the same way. They will signal by occupying a specific receptor on the stromal stem cell called the PPAR gamma receptor. They will occupy that, and that sends a signal to the nucleus of the cell for that cell to differentiate into a fat cell. Now, normally, you have your full complement of fat cells by the time you're about 8 years old. But if you happen to be exposed to these chemicals, you can keep making additional fat cells your whole life. Instead of supporting bone health by having these stem cells differentiate into bone cells, you'll be adding fat cells. Now, in addition to that, in these differentiated fat cells, once you have fat cells, these same chemicals can occupy, again, that PPAR gamma receptor, and that will cause the fat cell, the adipocyte, to actually grow bigger and larger. And so it will be able to absorb more and more fat from the environment, and hence you'll gain weight that way as well. Slightly different is the effect of Bpa Bisphenol A, and what that one seems to do is in the early developmental ages, so fetus and early childhood, it will actually reduce the number of fat cells. Now, that may seem like a really good thing. On the other hand, it also makes the remaining fat cells much larger. So we see that people with BPA exposure end up going through the same typical pattern of gaining significant amounts of weight as they age. And this is a very difficult thing to do, to counteract. Now, some of the other mechanisms that these chemicals use, in addition to increasing the number of fat cells, or in BPA's case, decreasing, but in both cases, increasing the size of the fat cells, is it also changes the distribution of the fat cells, going from the typical subcutaneous fat deposits around the hips, thighs, buttocks, into the visceral fat cavities. So it's surrounding your organs. And as these fat cells become larger, they become inflamed, they start casting off inflammatory particles called cytokines, and those cytokines then affect the organs that are sitting right next to them. And so you end up with inflammation taking place throughout the central cavity of your body. So your heart, your liver, your lungs, your spleen, the intestinal tract. There's a tremendous amount of inflammation that goes on there, and we believe that that's one of the primary mechanisms by which we see increased cardiovascular issues and problems. Some of these chemicals can also affect the hormones that control your appetite, that control your satiety, your sense of feeling full. So if I don't feel full when I'm eating, I will simply continue to eat. And that will ultimately result in weight gain as well. That also affects your food preferences and how you metabolize energy and how you use fat stores and things like that. So what do I do to protect myself from these things? Well, fortunately, we have these little recyclable triangles typically on the bottom of a lot of our plastic containers. So I can go ahead and typically look at and make special effort to stay away from any containers, particularly if they contain food. But if they are labeled as a 1, a 3, a 6, or a 7, those are typically the plastics that I want to stay away from. The safer plastics in general are going to be labeled in that recyclable symbol with a 2, 4, or 5. The number 3 is going to be the PVC. So that's going to be the Tributyl chemical family, and the organotin family of chemicals will be in that group. And number 7 is where the BPA resides. That's an ingredient that makes plastics more stable, a little bit thicker, a little bit stronger, and a lot of that's why it ended up in so many water bottles, because you wanted something that was a little bit more resilient and wasn't quite as flexible as a lot of other plastic products. But again, those are the polycarbonates, and consequently you want to stay away from those as much as you possibly can. Sort of the overall way of avoiding contact with these things is to eat an organic diet. If I do that, I stay away from a lot of these things that are used in packaging and the wrapping of food products. They will leach, and all of these plastics leach under either cold or hot temperatures. If I filter my water, any of these chemicals that have leached and gotten into the groundwater and ultimately the municipal water systems, I can avoid too much exposure, probably not 100%, but I'll avoid some of the exposure that I would get. And then I just want to minimize my use of plastic throughout virtually every aspect of my life. Instead of a plastic water bottle, even if it says, for example, today, BPA free, that's wonderful, except that a lot of manufacturers, both in water bottles and in canned goods, have replaced BPA with bisphenol, BP, S, and F, which are preliminary research, and research always lags behind industrial usage, seem to be even worse than BPA. So you're not really gaining anything there. What seems to be a better way to go on that is to use a stainless steel water bottle if you're using water bottles. Glass, ceramic, stainless steel, those always are going to be the preferable storage containers and use containers, certainly for food products, because you'll stay much safer if you do that. When it comes to things like the boarding pass for the airline, if I have a smartphone, I want to use that capability on the smartphone. On the other hand, if I don't, then I really don't want to hang on to that boarding pass. I want to use it. I want to touch it as little as I can. The cash register operators at McDonald's have extremely high BPA levels in their blood because they're handling these cash receipts all the time, and that's one of the studies that's been done. So you just don't want to handle these things. When I go to the grocery store, I thank the cash register person very much, and they can keep it. I don't really need to touch those things. Certainly if I'm paying cash, that's an easy enough thing to do. If I need it just to keep track of my cash register or my credit card utilization, then I'll ask them to put it in the bag. I'll carry it home, touch it once, and that's it. I really don't want to deal with these things all that much. On the pharmaceutical side, DES, which had such a horrible time, was actually not banned as a result of that. It's still in use. It's certainly its use has been limited. But we also find that there are other pharmaceuticals like Avandia, the drug the diabetes drug, also has the same effect and works through many of the same mechanisms in terms of increasing the number of stem cells, differentiating into fat cells, and increasing the size of those fat cells once they're made. So there are often alternative pharmaceuticals that you can get, and it's worth having a discussion with your physician to see if they have better suggestions that will keep you from putting on additional weight that you probably are not looking to do. And then again, eating organic, so I stay away from contamination with atrazine and things like that. And if I have a choice, I'm probably not going to rip out all the plumbing in my house, but so check, see if you have PVC piping or if you have copper, which is a better choice. And if you are doing any kind of remodeling and you're going to be replacing any of this piping, you'll want to go with the copper piping. That's it for Obesogens. I hope we've given you some suggestions and ways that you can yourself and your family stay safe in an unsafe world. And hopefully I will see you again on Saturday morning and then again Monday night when we'll look at additional ways of staying safe in an unsafe world. Thank you.